Welcome, everyone, to Copy and an Interview. I'm Dr. Jacqueline Pena, your host for this podcast. And today we have the pleasure of welcoming back Richard Capriola. He is the author of The Addicted Child, The Parent's Guide to Adolescent Substance Abuse. We spoke just a couple of years back about where we were with adolescent substance abuse and the resources he offers, as well as his book. And we just thought it was a great time to circle back and just get an update on what is going on, what resources are out there, and what can we do to help our youth. So I want to turn it over to Richard and just ask, Richard, welcome to the show, and ask you, how are you doing, and what have you been up to since we last spoke?
Well, thank you, Jacqueline. It's a pleasure to be back to visit with you about this important topic once again. Since we last spoke, way back when, I think it's been a couple of years, I've been working on promoting this book, trying to make parents and everyone else aware of this resource, because I really think it's important that parents have an understanding of adolescent substance abuse, the basics, that they know what the warning signs are. You know, it's like anything else. The more we feel prepared to deal with the problem, the more likely we are to catch it early and to deal with it successfully. And that's my goal. When I was working as an addictions counselor at Menninger Clinic, I treated many teens who were using substances and also had a mental health issue. And I would talk to their families. And after I explained to their families what the history was of their child using a substance, unfortunately, many times they would look at me and they would say, I had no idea this was going on. Or if they did suspect their child was using a substance, they might say something like, well, I thought something was going on, but I didn't think it was this bad. And these are good parents doing the best job they can. They miss the warning signs. And that's the motivation for me to write this book, was to help parents see the warning signs, so that if they catch this early on, they can deal with it rather than to wait until it advances and then they end up being in a crisis. So I think the best part of this book, perhaps the most valuable part of my book, is to inform parents about what warning signs they should watch out for.
I think that's an interesting point about maybe not seeing the signs. What are some of those warning signs out of curiosity?
The warning signs that I have in my book are warning signs for a child that might be using marijuana. I have another warning signs for a child that might be drinking alcohol. And I also put in warning signs for a child that might be developing an eating disorder, or a child that might be self-harming themselves, because sometimes, not always, but sometimes an eating disorder or self-injury will accompany a child using a substance. So it's important that parents know what those warning signs are as well. So all those warning signs are in the book. As a general rule, what I say to parents is pay attention to the changes that you see in your child. You know your child better than anyone. Don't assume that these changes that you might be seeing is just normal adolescent acting out behaviors. They may very well be that, but they also might be a sign that there's something else going on underneath the surface that you need to look a little closer at. Some examples would be a child whose grades are starting to decline, a child who used to participate in sports no longer shows an interest in doing so, a child who used to introduce you to their friends now becomes very secretive of who their friends are, a child who comes in at different hours of the evening, or is very secretive about where they've been and what they've been doing. And then, of course, if you notice any strange odors or you find any drug paraphernalia in the house, those are obvious signs. Now, if some of these behavioral signs sort of come and go quickly, it's probably not too concerning. But if they linger on and you begin to see more and more of these changes, then I think it would be wise to get a professional assessment to either rule in or rule out if there's a problem that you need to pay attention to and perhaps get some help with.
Interesting that you divide up in your book the warning signs based on the categories or types of potential substance abuse going on. So if it's alcohol abuse versus a certain kind of drug.
Yeah.
I think that that's important as well, because the warning signs might look a little bit differently depending on whether it's a process addiction, alcohol addiction.
Yeah.
other kinds, yeah, drug addiction.
Yeah, absolutely. And you raise the issue of process addictions, which I think is often overlooked. We have the chemical addictions, which is the alcohol and drugs, but we have the process addictions, which tend to be more behavioral addictions. And I've seen some of that in the adolescent population too. Things like video gaming. And now we have these compulsive attachment to the iPhones and social media. And that becomes almost addictive too.
Another question or thought I'm having is, when it's substance abuse, when it's alcohol or certain kinds of drugs, we can identify the warning signs a little bit better. But when it's maybe abuse, when it comes to food or process addiction or food addiction, that can be a little bit trickier to spot. Have you any thoughts on that, or have you done any work around more of the food addiction and the process addiction, and how can you find those warning signs, and how much of that are we really seeing right now, post pandemic, few years out of the pandemic?
Well, I don't think there's been much change in that. We're not seeing as high a level of adolescents being captured by things like eating disorders and self-injury. I do think that we probably are underreporting the level of self-injury among males. I've seen a lot of young girls who have a history of self-injury. I've seen some that are beginning to develop eating disorders. And many times these eating disorder and self-injury symptoms accompany a child using alcohol and drugs, because what they have in common is that whether it's alcohol or drugs or self-injury or an eating disorder, oftentimes it is a behavior that is used by the person to medicate an underlying mental health issue. Might be anxiety or depression or some type of trauma. So they're using the eating disorder, they're using the self-injury or the alcohol or the marijuana to medicate that underlying issue, which is very disturbing to them.
It's an interesting connection. I think you bring up a good point, and I'm going to circle back to something you said earlier before we jump into the research side of things. Earlier in the work you were doing before you wrote this book, you made a connection between substance abuse and mental health.
Yes.
And I wanted to see if you had any thoughts, if you wanted to share anything around the work you do as substance abuse and mental health.
Yeah, I worked at Menninger Clinic, which is a large psychiatric hospital in Houston, Texas. So almost all of the teenagers that I saw were not only using a substance, but they were battling a mental health issue as well. It might have been depression, it might have been anxiety, it could have been some type of trauma, or maybe even an emerging personality disorder. And when I talked to many of the teenagers who were smoking marijuana, and I asked them to help me understand why they were smoking so much marijuana, the number one answer that came back was, it helps me with my anxiety. So for a lot of these kids, and unfortunately, many of them go undiagnosed when it comes to the mental health issue. We pick up and we notice the substance abuse, the drinking of alcohol or the smoking of marijuana. We catch that easily, but unfortunately for these kids, for many of these kids, we miss the underlying mental health issue that might be present, um, and is being used to medicate, so that these kids are using marijuana or drinking alcohol to really medicate an underlying mental health issue that unfortunately often goes undiagnosed and treated and untreated.
I think this topic about mental health and diagnosis is a big one because I think I'm seeing post COVID, we're more and more likely to talk about mental health, right? I know growing up for me, it was taboo to talk about mental health and any symptoms around mental health conditions or diagnoses. As the daughter of immigrant parents, the idea of seeing a psychologist was a big taboo
Yeah.
growing up. And of course, things change and we learn. But I think we're opening the doors for more conversations about mental health. So we're able to look at that and tackle that versus only focusing on the self-medication that we might be doing with other substances
Mhm.
or other symptoms that are masking the real symptoms of something bigger that we're not looking at in terms of mental health. So I'm glad that there's more and more work being done around mental health that we can focus on the mental health. I think that's so critical today.
We've known for over a decade that there is a mental health crisis in the adolescent population, and it's not really getting that much better. And I think the pandemic had the effect of really um, increasing the number of children that are struggling with a mental health issue. It's interesting that because during the pandemic year, what we saw was a significant decline in adolescent substance abuse. Their use of alcohol and drugs went down during the pandemic year, but but the mental health issue went up. So we still have a mental health crisis in this country among adolescents and adults as well.
Yeah, and something for us to keep our eyes open and look at if we're seeing signs of any mental health
Yes.
concerns that we can address so that we can address them early before we jump into any kind of substance abuse to drown out some of those symptoms or feeding
Yeah.
into the confusion we feel when we're going through mental health challenges. So
And if we do find a child who is abusing a substance, it's important to get a psychological assessment done to see if there is that underlying problem that the child may be struggling with, to either rule it in or rule it out, because it's significant enough that you don't want to miss it. So you end up treating the marijuana use, but you don't treat the anxiety or the depression.
now, a lot of our conversations are based on research, and I wanted to come back to the research that you're using for your work and the
Uh-huh.
research that you use for your book. And if you could talk a little bit about where you're getting your research, what is that research, and what are some of the highlights of that research? What's that research saying to us right now about substance abuse in adolescents?
Sure. The research is from the University of Michigan. They conduct an annual survey of eighth graders, 10th graders, and 12th graders. And they've been doing this for a few decades, so they have a wealth of statistical data behind them. But each year they survey these students in those three grades. And what they're looking for is what kind of drugs they're using, how often they're using these drugs, and what their attitude is about these drugs. For example, do they think these drugs are dangerous? And also, how available are these drugs? What do these kids think about the availability of these drugs? So that information is all assembled every year, and it gives us a wealth of information on not only what these kids are using, but what they're thinking about these drugs. For example, we've noticed over the years that these drugs are widely available to kids. When the survey asks them, how easy is it for you to get marijuana? Over 80% of them tell us it's no big deal. They can get it if they want it. The same thing on alcohol. Well, how easy is it for you to get alcohol? And they say, not a big deal. It's easy. And then we ask them, well, how dangerous do you think these drugs are? And overwhelmingly, the response we get is, we don't think they're very dangerous. We don't think marijuana is dangerous to us. We don't think drinking alcohol is a big deal. That data comes in every year, usually right after the first of the year, with the results of the survey that they did the previous year.
Interesting. Now, does that survey ask them about drugs? For example, I know we have a fentanyl crisis, right, in the
Yeah.
US. Does it ask about drugs like that, synthetic drugs or other?
Yeah, it asks about all kinds of drugs. Certainly, the most popular drugs among teenagers continues to be alcohol, marijuana, and vaping. We had a vaping crisis for 3 years up to the pandemic, and it still is a problem, vaping of nicotine and vaping of marijuana. But it does survey all other illicit drugs as well, all of the opiates, prescription medications, cocaine, a whole list of drugs. Fortunately, what we found over time is that most of these really hardcore drugs are at very low percentages, less than 5%. In some cases, less than 2 or 3% of kids using the hardcore drugs. Consistently, what we have found is that most of these kids are using alcohol, marijuana, and vaping. For example, we just found out that when it comes to vaping nicotine, roughly 23% of high school seniors are vaping nicotine. When it comes to alcohol, almost half, 46% of high school seniors are drinking alcohol. So, alcohol, marijuana, and vaping, I think, are the primary substances that adolescents are drawn to. And that's been true for a long, long time. Vaping within the last 5 years, but alcohol and drugs, 10, 20 years.
Now, have we seen any reductions in usage among adolescents of any kind of substance since the pandemic, out of curiosity?
The pandemic drove down the adolescent substance abuse significantly because kids were, locked at home. They weren't going to school. They were pulled away from their peer groups and from their activities. So we did notice a significant decline. Now, since the pandemic, the research has shown that we have not gotten back to pre-pandemic levels. We're still below pre-pandemic level, or still below pandemic levels. So it hasn't rebounded as much as we thought it might have. Whether or not it will ever get back to the pre-pandemic levels, only time and history will tell us that. But the levels, even though they're not up to the pre-pandemic level, they're still pretty high. When you have 15% of eighth graders drinking alcohol and 31% of 10th graders drinking alcohol, and you have 20% of high school seniors vaping marijuana, those are significant levels. So we still have quite a bit of work to do to help get those levels back down.
What do you think are the reasons why adolescents first start using or trying
Yeah.
different substances like alcohol? Or, I wouldn't even touch the food or process addiction yet. But what do you think are what motivates them to first start trying this?
Every kid's different, and for some of them, it's peer pressure. They feel pressured by the friends that they're hanging out with. Some of it is, if it's not pressure, it's just hanging around with kids that might be drinking alcohol or smoking marijuana, and they want to join in. And then for some, not all, but for some, there is that underlying mental health issue that we were talking about, that they have stumbled upon using a substance, say like marijuana, to help them with an underlying mental health issue. So different reasons for different kids. Some of it definitely is peer pressure. Some of it is their social group that they hang around with. And then there's a group that are using it to medicate an underlying mental health issue.
Now, there's a term called an addictive personality that I've heard a few times. I've used it for a situation in my own life. What are your thoughts on the addictive personality? This idea that there are some individuals that are more prone to be addicted to a substance. They tend to
Yeah.
have that addicted, like whether it's a process addiction as well, not just a substance, but it could be a process addiction, this addictive personality. Have you done any work around that or seen anything about that?
Well, the term addictive personality is sort of is sort of a term that's out there. It's I'm not sure it's defined very well, but we have known for years that there is a genetic component to addiction, and I suppose that's as close as we can get to saying an addictive personality. We know, for example, that 40 to 60% of a person's vulnerability to become addicted to a substance is purely genetic. And that's true for many medical disorders. For example, if you have hypertension that runs in your family, you're more at risk of getting hypertension. If you're a woman and you have breast cancer in your family, what does that mean? It means that you're more at risk of getting breast cancer. It doesn't mean you're going to get the breast cancer or get hypertension. It just means that because you have a genetic background in your family, you're more predisposed. You're more likely to be vulnerable to getting that. It's no different for addiction than it is for any disease. If you have a genetic background of addiction, you are at risk of becoming more vulnerable to becoming addicted. Doesn't mean you will, it just means that you are more vulnerable. And knowing that information, like any other disease, if you know you're vulnerable to any other disease, what does that mean? It means you're more careful. You're watching what you're doing. So the same is true for addiction. There is a genetic component, 40 to 60%. Well, if 40 to 60% is genetic, what's the rest? The rest is environmental factors. And that's where we see high levels of stress, all of the emotional issues, all of the underlying psychological issues, they come into play, which can take a person who is genetically vulnerable and sort of push them over the limit. So it's a combination of genetics and environmental factors.
Interesting. Yeah, that makes perfect sense. I think I've heard that term so many times, addictive personality, but the operational definition never as clear. Is it a genetic reason? Is there a genetic definition? Is it environmental? Is it psychological? And I think that you presented it in a very clear way that we need to think about the operational definition, and then you framed it around genetics.
Yeah.
So I think that's very helpful. I wanted to ask you, in terms of research and the changes we've seen since post-pandemic, what are the top things we should be looking at, whether we're parents or teachers or anyone who works with adolescents? What are some of the top things? I know we talked about warning signs, but what are some of the top things you think we should be looking at? Maybe it's not warning signs, or maybe it's how we approach things. What are those tips, those top tips? Let's say that, top tips for us.
I think I would be most concerned about the level of vaping that's going on within the adolescent population, whether it's vaping nicotine or vaping marijuana, because uh, it's getting really significant. And it was before the pandemic too. For 3 years prior to the pandemic, we started to see dramatic increases in kids vaping nicotine and marijuana. The pandemic reduced it a little bit, but now it's rebounded and it's getting back up there. So I would be concerned, about this epidemic that's going on with vaping nicotine and vaping marijuana. Kids are turning to vaping nicotine as a way of getting their nicotine. They're not smoking cigarettes anymore. That's at an all-time low. But what's happened is kids have moved over to vaping their nicotine. And the problem with that is that when you're vaping nicotine, you're getting higher concentrations of nicotine. When you're smoking cigarettes or cigars, you're getting tobacco and a lot of other carcinogens. But when you're vaping nicotine, you're getting pure nicotine, which means you're getting higher concentrations of nicotine. It becomes much more addictive quicker. So I would be concerned about the vaping epidemic that's raging and going and running through the adolescent population.
No, there have been a lot of regulations and restrictions around cigarettes. Some states can sell menthol cigarettes or flavors,
Yeah.
for example, all kinds of things that I think also contribute to a decrease in cigarette use, plus how we portray it in media, including social media. But
Yeah.
in terms of vaping, we've had a lot of legislation, a lot of regulation, a lot of policies, a lot of um, legal action taking place across different states. Do you think that's had any impact on vaping, or how is vaping still such an issue when we're trying to make so many changes in different states? What do you think's going on there?
Well, the data would indicate it's not having a big effect. The percentages of kids that are still vaping is still very high. Um, so I'm not sure that what we've been able to do has had a significant impact on kids and the degree to which they're vaping either nicotine or marijuana. It's just not getting through to them yet.
Yeah, because as you're saying that, I'm thinking about all the changes we've seen with whether you could do menthols, you sell cartridges too, and all these vaping equipment. But yet I see a lot of people still pull out a vape and a little puff of smoke in a
Yeah.
restaurant, or at the airport, and it's still very popular to a lot of people are carrying their vape pens.
And it's and adolescents are finding it to be very convenient. You don't have to smoke an entire cigarette. You can go off to the men's room or the boys' room or the girls' room in school and pull out your vape pen and get a couple of puffs and go back to class. And the vape pens are easily to conceal. You can carry them in your pocket. Some parents might not even recognize them as being a vaping pen. So I think the fact that they are so convenient and so easy to use and to conceal is another reason why they become so popular with the adolescents.
And the smell too, because when you smoke a cigarette, it's hard to mask that smell.
Yeah,
Not just the smell coming out when you're smoking, but on your body. But
yeah,
the vape pen, you can't really tell a lot of times. There's something that smells fruity,
right.
like a quick perfume or a quick spritz you put on.
Yeah.
So talking about all these things, I want to talk about resources that you offer. You have a book that I read before our last interview, and you also have a website. Could you share a little bit more about what's in your book? Why should we read your book? And where can we find your book?
The book is I kept it to around 100 pages, and I did that because parents are busy. They don't have time to read volumes of information. So I wanted it to make something that was convenient for parents to read, that they could read fairly quickly, fairly easily, and keep as a resource and give them some background information so that perhaps they felt a little bit more confident about this topic. They hope they don't have to deal with it, but hopefully they feel that if they do have to deal with it, they feel better prepared. So I have chapters in there that help parents understand how these drugs work in the brain and how important the developing brain is to the adolescent and the need to protect the brain. I have a chapter that advises parents on if you suspect your child is using a substance, what tests should you get done? What assessments should you get done? And then I have brief little chapters on the different street drugs that are out there. Parents know about alcohol and marijuana, those are fairly common, but they may not know about some of these other drugs that are out there on the street that kids have access to. So I built into the book brief chapters that help parents get a better understanding of what those street drugs are that kids might have access to. I have a chapter in terms of, how do you, if your child needs a treatment program, how do you know what a good treatment program looks like? What questions should you ask a potential treatment provider? I have a chapter that explains the different treatment options. We have outpatient treatment, we have inpatient treatment, and we have residential treatment. So, what I've tried to help parents understand the differences in those types of treatments. And then there's a chapter on eating disorders, warning signs. There's a chapter on self-injury warning signs. And then there's a chapter that just lists resources so that parents have access to more information. So my goal in writing the book was basically that parents could read the book and walk away and feel a little less afraid and more confident that if they have to deal with this issue, they feel better prepared to do it.
You talked about harming adolescents harming themselves, and we haven't
Yeah.
chatted a lot about that. Can you share a little bit more about that? How prevalent is that across the nation, especially based on the studies from the University of Michigan? What have you been seeing from the research you're looking at in terms of adolescents harming themselves?
Well, the I don't think that the percentage is extremely high. I would say that, in my opinion, there are probably more boys that go undiagnosed than girls. The adolescents that I worked with who were self-injuring were almost predominantly girls as opposed to boys. I suspect that there's more boys who are self-injuring than there are that we know about. Um, and that's a very difficult challenge for parents because teenagers are very, very good at hiding their self-injury. They do it in locations on their body that are not visible. They know how to hide it. So it's important that parents know what some of the warning signs are and what to look for. Um, I don't think it's a very high percentage of adolescents who are self-injuring, uh, but it's just something else that parents need to be aware of and at least know a little bit about what the warning signs are.
And I know I took us down that path because we didn't get a chance to talk about that, but this came out of your book and you telling us about your book. But you also have a website with resources. Tell us a little bit about your website.
The website is www.helptheaddictedchild.com. Helptheaddictedchild.com. When you go to the website, there's information about the book, Help the Addicted Child, A Parent's Guide to Adolescent Substance Abuse. There's a sample chapter that you can take a look at. And there's also some blog articles that you might find interesting. One of them that I think is really interesting is I have a blog article on 10 questions that you can ask your child to check in on their mental health. And this is particularly good for young children. One of the questions is if it if your emotions, if your feelings were weather, what kind of a day would it be outside? So you can just ask the child that, and they'll come back and they'll tell you, well, it's a sunny day, or it's a rainy day, or it's a cloudy day. And you can use that to sort of get involved in a discussion with your child about their feelings. So simply asking them, well, if your feelings were weather, what would it be like outside? And so there's about 10 of those questions that you can use to check in on your child's mental health. Um, so I would encourage everyone to go to the website just to take a look at the blog articles and see if any of them interest you. There's also a link that will take you to Amazon where you can purchase the book either as a Kindle or as a paperback. This can be a resource for teachers. I have talked to some teachers on this subject, and I think it's an excellent resource for teachers because teachers oftentimes pick up on some of these warning signs even before parents do. So I think it's a good resource, hopefully that will help teachers better understand what's going on with adolescent substance abuse and know the warning signs to look for too.
Now, we've had a great conversation. Thank you for joining me for a follow-up interview after these couple of years post-pandemic. I wanted to ask you, what has been the top lesson that you have learned in this area of adolescent substance abuse? What has been the top lesson that you have learned over these years that you've been working in this area?
I think the biggest issue that I have learned is that our education system is not doing as good a job as it can to help address the adolescent substance abuse problem. I think that there's much more that the education community can do, and by that I mean to to provide a neuroscience curriculum to help kids understand how important it is to protect the adolescent brain. You know, the approach that we use all too often is basically, don't do drugs. Drugs are bad for you. Drugs are illegal. And I can tell you that for most teenagers, that doesn't mean anything. They don't care about it. They don't believe it. When I would talk to teenagers, it didn't do me any good to tell them that the drugs were illegal or that they were bad, because they didn't care about all of that. But what did work was when I talked to them about the neuroscience, when I talked to them about the brain, when I talked to them about how important the brain is and what it does and how it's only developing, that they were curious about, that they wanted to learn about. So I used a neuroscience approach to open the door to begin a discussion of not just protecting their brain, but how drugs work in the brain, because they were interested in that. And when they discovered how these drugs work within the brain and how they can change the brain, then they began to seriously consider whether or not they wanted to use substances. So if I was in the education system, I was for a long time, but if I was developing a program to help kids stay away from alcohol and drugs, I would focus on the neuroscience. And I would start in the elementary grades where I would teach kids about the brain, not the drugs, just the brain. And then as they moved into the middle school and the senior years, then I would introduce how drugs work in the brain.
Fascinating. Very interesting. And we haven't had those conversations what you just shared previously in this episode or our first episode
Right.
together. So it's great that you brought that here. But how to be able to integrate some of this into education systems so that we can help our youth when they're younger,
Yeah.
from the front end rather, and reduce the number of cases in which we're helping at the other end where they're already using for a while,
Yeah.
and maybe masking some other issues, or whether they're hurting or harming themselves for a while, or they've been in process addictions for a while, or food
Yeah.
addictions, not just substance abuse.
Right. Exactly.
Yeah. And for a lot of our listeners, we have teachers, we have parents, we have students, we have all kinds of listeners, business owners who are parents, or aunts, or uncles, or grandparents. What advice do you have for us now? We've come out of the pandemic a few years already. We've transitioned in multiple ways. Things have changed. The research has shown some of those changes. What advice do you have for us?
My advice is to not become paranoid about this issue. I know it can be a it can be a very scary topic for parents. Um, don't assume that it can't happen to any child, because it doesn't matter where you send your child to school. It doesn't matter whether you live in an urban, suburban, or rural area. It doesn't matter what church you go to or what your level of income is. All children are vulnerable to being captured by alcohol or drugs. All children. Um, so don't become paranoid about it. Learn as much as you can about it. Learn the warning signs. Feel hopefully that you can deal with this issue if you have to, and you know what to do. You know, um, knowledge is very powerful. The more we know about something, the better we feel able to deal with it if we have to. So empower yourselves, learn what you can, and don't become paranoid about this, but just become better prepared and more confident that you'll be able to deal with it. Because I really think that if you have the knowledge and the information, you can deal with this in a way that will help you and help your family as well.
Thank you. I very much agree. Thank you for that advice. And as we come to a close, do you have any final thoughts, anything else you want to share with us that I haven't asked you today in the interview?
No, you've done a great job of really comprehensively covering this subject in a short period of time. So thank you. I appreciate your insight and your questions and the discussion that we have and that we had. And I hope everybody that listens to us feels a little bit better informed and better prepared.
No, thank you. Thank you to you. I think I've had so many experiences with, alcohol abuse and other substance abuse with different family members, and experiences with process addiction, which I didn't even know was a thing. And now looking back, I understand what was
Yeah.
happening. So the tools you provide have been helpful in understanding lived experiences on my end. And I think that they're helping me be able to be more supportive and help others. So I hope our listeners do find these resources very helpful and the information helpful. I know that each time I read the book or talk to a teacher, I learn something new or have a new aha moment that I hope you all get after listening to today's podcast. And to Richard, thank you so much for joining me for our second dance on the dance floor, as I call it. Interview number two. We're checking in and seeing what's going on out there and what do we what do we need to be paying attention to. Sorry about that. And here we are, looking at that data, looking at the trends, and really making sure that we're doing the right thing as we move forward and that we're supporting our youth the right way.
Thank you, Jacqueline. I really appreciate you taking the time to speak with me and to participate in this discussion. So, thank you, and I hope everybody who listens to us has learned a few things.
Thank you. And in the episode description for all of you listening, you'll have more information about the book, the Amazon link, as well as the link to the website so that you can also take advantage. So thank you everyone for listening. Richard, thank you once again for being here today. And thank you everyone for being here with Coffee and an Interview.